So are mercury fillings safe or damaging? What I'm going to talk to you about comes from scientific literature from the International Academy of Oral Medicine and Toxicology and various other authors that have done extensive research into the mercury filling. And now I'm going to get into a little bit of the history of the mercury filling, how this came about and why it's so entrenched in the dental field, in the dental schools, and why mentor after mentor after mentor has pushed the same mantra. And then I'll get into a little bit about the actual chemistry of the mercury filling. I'll get into its qualities and how it operates and why it was used in the mouth. And then I'll talk to you about its functionality as just a material, and then alternatives and things that you can do in the future if you're a potential patient to go to the dentist's office, or if you're a doctor watching this presentation. So the history of the mercury/amalgam filling shows that in the early 1800s, there was a group of dentists from Europe that came over and they brought an alternative filling material. Because what happened is a lot of people would suffer from tooth decay and they'd go see their dentist and they would pull the teeth. Or if they had some money, they'd put a gold filling there. That was called the gold group of dentists. The problem is it was limited to only a small percentage of people because people wouldn't have the money to do that. So ultimately people lost their teeth as they got older from tooth decay and gum disease. So this gold group was in place in the United States. This group from Europe came over with this black slurry looking material, and it was composed of mercury and it was composed of tin. Later it had some copper and some zinc in it. But originally it was basically just silver and mercury. So when the guys from Europe brought this over, the gold group dentists had concern about the mercury in it, and they said, no, it gets locked in there because when you put silver in there, the silver absorbs the mercury, and then you can pack it in the cavity of a tooth. It's very cheap, very inexpensive, and then it solidifies and hardens. So they brought that concept over. It gained in popularity because it was so much more affordable. People could afford those black fillings, and away it went. And then they even changed the name over time and called it an amalgam because there was so much concern about mercury in it. So the mercury guys came over, and eventually they gained popularity. And more people were asking for the mercury filling, which was now called an amalgam, because not too many people want to have mercury put in their mouth. So what happened is that they grew in popularity, they formed a group, became a large organization, it ousted the gold guys, and this new group formed. And lo and behold, it was called the American Dental Association. And that formed, I believe, in 1859. And since that time, they've had the premise, they were backed and founded by the mercury amalgam filling. Now we fast forward in time, and it becomes more in use. Now the founder or the father of modern dentistry, called G.V. Black in the 1900s, laid out the protocol for using these mercury fillings. And they were only meant to be in very small little cavities, very tiny cavities. When they got to a certain size, or if they were being placed near the gum line, they were never recommended. It was always gold. But over time, it was so cheap and easy to use, you could just plug it in, clean it up, polish it, and the patient could walk away. It got used in ways that it was never meant to be used. And what's the real problem with it? So it has what's called elemental mercury in it by 50%. Mercury comes out as a vapor. Also, it's a solid and it's a liquid at room temperature. That means when we place a mercury filling in someone's mouth, the mercury can be outgassing as a vapor 24/7. This is not really anything that's not agreed upon and known. Even the American Dental Association would say, yes, the mercury does come out. But the premise is it comes out in such low amounts that it's inconsequential. Well, you have to understand it may come out in what we call a tiny amount constantly and continuously. So one filling by itself, one mercury filling, can outgas between 3 and 10 micrograms per day. Now, that's still very small, a thousandth of a gram. It's a very, very small amount, but it's doing it every day over and over and over. What's the big deal with that? Well, if it's a vapor, you can breathe it in. It can get into your bloodstream and it can cross the blood-brain barrier. If it gets into the blood-brain barrier, it jumps and it lays itself along the myelin sheath, which is the protective coating over your neurons in the brain. If it does that, it blocks the functionality of that sheath and being able to stay in a survival mode and operate properly. Now we have studies that show it can go to the brain, it goes to all the major organs and into the bone marrow of the body. And it's very, very hard to remove. Well, is it linked to anything? Well, the IOMT says it's linked, and obviously association doesn't mean causation, but it is associated with increased neurologic problems because it is listed, mercury is listed as a toxin. It's a neurotoxin. So any amount we don't want to have in the body. As I would say, what if we told our patients, I'm going to put a filling in and it's got a little bit of cyanide in it, just a little. It comes out a little bit, but it won't really harm you. Would you agree to have that done? And most people would say no. Well, mercury is way more toxic. In fact, it's one of the top 3. It's the 3rd most naturally occurring elements on the planet. It's the 3rd most toxic. So again, there's links to neurodegenerative illnesses, tremors, dementia, Alzheimer's. There's also problems with kidney. There's problems with skin. So it depletes these pathways the body would normally use on other things. So people can get tested to see if they have a heavy metal burden in their body. There's hair tests, blood tests, and fecal tests that can be done to see what's there. Now, let's look at its physical properties. When we place a mercury filling, once we remove decay and cut through a tooth, we can weaken that tooth by up to 66%, especially if we're cutting all the way through the tooth on the chewing surface. So we want to ideally replace that part of the tooth with a material that's going to reconnect the tooth side to side, front to back, top to bottom. It'd be a type of adhesion. The mercury filling now placed, go, wow, we've filled that hole. Now let's look at the dental engineering aspect of this. The material itself expands and contracts 2 to 3 times more than a natural tooth. So you would ask, okay, if it's expanding and we eat something cold, something hot, it's going to expand and contract. If it does that, what could happen to the tooth? Well, it can break, or we see cracks in it. And sure enough, that's what happens, especially with the larger mercury fillings. We begin to see cracks in the teeth, and sometimes we see a catastrophic crack. It goes right down the middle of the tooth breaks and has to be extracted. So then we put a material in that would at least buy them some time, but they'd probably end up breaking their tooth if it was a large one and losing the tooth anyway. But now they're getting exposed to mercury, which is a toxin. So there's got to be some better solutions, and there is, which I'll talk about in just a moment. So from the physical standpoint, we want to make sure whatever we put in the tooth, can we seal that tooth and put in materials that mimic or copy the inner part of the tooth, which is called dentin, which means indent, which means in the tooth. And the hard outer surface is enamel. Enamel we all know about. It's very hard, it's very acid resistant. In fact, it's the hardest structure we have in our body, twice as hard as our bone. And how can we rebuild those things that we've just cut away? Well, in the field of biomimetic dentistry, which means copying life, using materials that can rebuild that tooth in layers so that we attach the tooth again to its original strength, or at least 95% of its original strength. And that's what can happen with biomimetic dentistry. The good news is there's a solution to the mercury filling. If you have them, You want to find someone that's trained through the IAOMT, one of these organizations that knows how to place oxygen, knows how to prepare the site. If it releases a lot of the mercury vapor, we want to make sure that you as a patient are protected, but ourselves as the healthcare providers are protected. And we want to make sure the environment's protected with proper air filtration. Now more and more dentists are learning these protocols, and it's called the SMART protocol, which is Safe Mercury Amalgam Removal Technique. And those protocols are very simple. There's a swishing of the mouth with activated charcoal, and that will help capture any little bits and pieces vapor-wise of any mercury that we may not be able to isolate. And then we place what's called a rubber dam, properly sealed. There's suction underneath it, there's suction outside of it, there's a larger suction, and then there's air filtration. It's really not that difficult. The patients like it, they're isolated, everything's calm, and they get everything removed in a safe manner. So that can be done. That's the SMART protocol. And I highly recommend you search out people that do that if you need mercury removed. So for the people that are watching in the future, if you don't have these type of fillings, make sure you're never going to get a mercury filling, because that's almost 200-year-old technology. And the way we do things have evolved. It's time for that to evolve as well. Plus, we have a tremendous environmental burden on mercury waste and mercury fillings and going into our groundwater, ground supply, etc. And it leaches in there, and we don't want that anymore.